Welcome to today's episode, where we'll dive into an exciting shift in managing DKA, using subcutaneous insulin instead of the traditional IV insulin pump. This method offers a less invasive, more convenient alternative for mild to moderate DKA cases, with promising outcomes. We'll break down the protocol, benefits, and how it's changing emergency care for diabetic patients.
Okay, so picture this. Treating a serious diabetic complication, but not in the ICU. We're talking like a simple injection. That's the potential game changer we're diving into today. Subcutaneous insulin for DKA.
Yeah, it's a big departure, right, from the traditional IV insulin in the ICU. And you're right, it could really change how we approach DKA.
Definitely. So for anyone who's maybe not familiar, what exactly is DKA?
So DKA, it's basically like a system failure for people with diabetes.
Okay.
Insulin, right. It's what helps your body use glucose energy. But without enough insulin, your body starts breaking down fat instead. And that produces ketones.
And that's where the trouble starts.
Exactly. Ketones build up in your bloodstream. It increases the acidity. And, it can become life-threatening really fast if it's not treated.
Wow. So we're talking about a serious condition, ICU level, right? But now research is suggesting subcutaneous insulin, the kind you inject under the skin. It might actually be a safe, effective alternative, for some patients at least. And we're seeing this in multiple studies, right? This isn't just a one-off.
Right, yeah. There was one study that found subcutaneous aspart insulin. It was just as effective as IV insulin for uncomplicated DKA. And then another one, it highlighted how successful it's been in places with limited resources, like a rural clinic where before they'd have to transfer DKA patients to a hospital far away.
Yeah.
But now they could treat some of those cases right there, on site. Saves time, money, resources. It's a big deal.
That's huge. It's like bringing that critical care to the places that need it most.
Yeah.
And making it, more affordable, potentially.
Yeah, exactly. Of course, we need more research, to confirm those long-term outcomes and the cost effectiveness. But
yeah,
the potential is there. It's exciting.
It almost sounds too good to be true. Are there any, caveats we need to be aware of?
Oh, for sure, for sure. This isn't a cure-all, not even close. Patient selection is critical, absolutely critical.
Okay, so not every DKA patient is a good candidate for this.
Exactly. This approach is generally, it's best suited for adults with mild to moderate DKA, not pregnant, and with a Glasgow Coma Scale score over 8.
The Coma Scale, that's to assess their level of consciousness, right? How alert and responsive they are.
Exactly. We want to make sure they're not at risk of slipping into a coma. Now, if it's severe DKA or other complex health issues, ICU is still the safest option, the most appropriate.
So it's all about choosing the right treatment for the individual. But if someone does qualify for subcutaneous insulin, it seems like the benefits could be huge. But what about safety? Like rolling this out on a larger scale, wouldn't that require, really careful implementation?
Oh, absolutely. We need clear protocols, comprehensive staff training, and the patient monitoring has to be rock solid.
And what does that monitoring actually look like?
So you're closely tracking blood glucose, ketones, electrolytes, vital signs, mental status, everything that paints a clear picture of how the patient's doing. Got to catch any problems early. And you need a plan. If you need to transfer them to the ICU.
Okay, so it's not as simple as just giving an injection and hoping for the best. You need vigilance, a really coordinated approach.
Absolutely. And that's why understanding the different types of insulin and how they work, it's so important, right? Especially with subcutaneous injections. And that's where these insulin analogs come in.
Okay, yeah, insulin analogs. I've heard the term, but can you remind me why they're so important in this context?
Sure. So we're not getting that immediate surge of insulin, right, like you do with IV. So using these fast-acting analogs, it helps us get closer to the body's natural response. They have a faster onset, and they don't last as long compared to regular human insulin. So that makes them a potentially good fit for subcutaneous DKA management.
So we're using the latest in insulin technology to fine-tune our approach to DKA.
Precisely. It's a great example of how, scientific innovation leads to treatments that are more targeted, more effective.
Wow. That's fascinating. It sounds like we're, on the verge of a huge shift in how we manage DKA. But how does subcutaneous insulin even work? Like, what actually makes it a viable alternative to IV?
That's a great question. And it comes down to, understanding how insulin behaves when it's injected under the skin compared to delivering it directly into the bloodstream. Right. So with intravenous, you get that immediate surge of insulin go straight into the bloodstream. And in the ICU, a lot of times that's what you need.
Right.
But with subcu, the absorption's slower, more sustained. It's less of a shock to the system, you could say.
A gentler approach, maybe?
Yeah, exactly. And for some DKA patients, that slower release, that steady release of insulin, it might actually be more, physiologically aligned with what their body actually needs. It's not just about how fast it gets in there. It's about like mimicking how the body naturally releases insulin.
Makes sense. So we're kind of like, I don't know, tricking the body into thinking it's producing the insulin itself.
In a way, yeah. And that's where those insulin analogs, remember those? With the fast onset, the shorter duration, they really come in handy for sub-Q DKA management.
So we're taking these advancements in insulin tech and using them to actually create these more targeted treatments.
Incredible.
That's incredible. But okay, let's zoom out for a second. Big picture. If subcutaneous insulin for DKA, if it becomes more common, what could that mean for, I don't know, diabetes care in general? What are the ripple effects?
Now you're talking. This is the exciting part. The implications they're huge. I mean, first of all, ICU resources. Think about it. If we can treat some of these DKA cases safely and effectively outside the ICU, that frees up beds, frees up resources for the people who really need that level of care.
And that is huge. I mean, especially with how strained our critical care resources are these days, and the rates of chronic diseases like diabetes, they're only going up.
Exactly. And then there's the financial side of things too. ICU stays, they're not cheap, right?
Right.
So if we can achieve those same outcomes, but with sub-cure insulin in a less intensive setting, the cost savings could be huge. Think about what that could mean for healthcare budgets. Underserved communities, it's a game changer.
Yeah. We could be talking about making this level of care more accessible, more affordable, and improving patient outcomes at the same time.
Exactly. And let's not forget about, the patient experience. I mean, recovering from DKA, it's never easy. Yep. But imagine if you can recover in a more comfortable setting, less intimidating than the ICU. That can make a world of difference for someone's well-being.
Right. It all comes back to that patient-centric approach.
Yeah.
Finding the best care for each person. But like any big change in medicine, we have to be careful, right? So what are they focusing on now as they keep looking into this?
Well, one of the big things is long-term studies. The early findings, they're promising, very promising. But we need these bigger studies, more extensive, We have to confirm those results, really understand the long-term effectiveness and the safety.
Right, so we need that really solid foundation of evidence before we go changing how we manage DKA across the board.
Exactly. And those studies, they'll also help us, fine-tune things. The patient selection criteria, the treatment protocols, make sure we're delivering the right care to the right patients at the right time, minimize those risks, maximize the benefits.
So it's not just about proving that it works. It's about figuring out, how it works best.
No.
And for whom.
Exactly. And it's not just confirming what we think we know. It's about uncovering what we don't know. What are the drawbacks, the limitations? Are there certain patients who might benefit more or less? These are all questions that more research can answer.
So it sounds like there's this sense of, cautious optimism. This could be huge, but we have to make sure we're doing it right.
You got it. It's about laying the groundwork so that in the future, we can treat DKA better, more effectively, more efficiently, and, more compassionately than ever before.
It's like we're seeing, the very beginning of a whole new way of thinking about diabetes care.
Yeah, and that's what's so cool about this research. It's not just tweaking what we already do. It's a whole new path.
And we could be talking about changing the lives of millions of people living with diabetes.
Absolutely. But we're still in the early stages, right? Research is a journey.
Always more to learn, for sure.
Exactly. And that's what makes it so, dynamic. Always evolving. Who knows what else we'll find out there in the world of diabetes care, right?
Right. I'm feeling really optimistic. This has been, it's been an incredible deep dive.
For sure. We've gone from the traditional ICU to this whole new thing with subcutaneous insulin. We looked at the research, the benefits, the challenges, even the science behind it all.
It's a lot to take in, and I hope our listeners, they feel like they learned something today. This was helpful.
Knowledge is power, right? Especially when it comes to your health. The more you understand these advancements, the more you can advocate for yourself, make good decisions about your own care.
100%. And with that, we're going to wrap up this deep dive into subcutaneous insulin for DKA. This has been fascinating. I don't know about you, but I've learned a lot.
Me too, absolutely. And to everyone listening, stay curious out there, keep asking questions, and, never stop exploring. The world of science and medicine is always changing. Until next time.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.